Hi again, everybody. We've got a special episode of the Narrative Podcast for you today. Mike Andrews, Aaron Bear, and we're coming to you live because
We
we
can actually
have
do that.
big news that we wanted to talk about. Really a historic day in a lot of ways because of a bombshell report that just dropped today called Wolves in White Coats. It is exposing the fraud that's been running rampant through the medical system, and how the subtitle is how doctors and hospitals pushed and profited from the fraud of gender medicine. Aaron, you're listed as a author on this report. First of all, thanks for your work in bringing this to light. And how did all this start coming together? First off,
Yeah, this has been something that's been in the works for a long time, and something that, for a lot of us who have been involved in protecting kids from gender medicine, we have been wanting to see, because, it's still jarring when you really step back and think about what's been going on in our country, where children and families were wrapped up into what was so very clearly a lie, right? It's one thing for say it's an experimental cancer medicine or something like that, but this was a lie of like your kid's born in the wrong body, right? Something so obviously stupid. But the question was, how was this allowed to become so pervasive? It was everywhere, right? You see that in the report. It was in a handful of clinics in the early 2010s, and it was hundreds by the early 2020s. So how did that actually happen? And so this has been the work of a lot of great researchers, doctors, lawyers, who wanted to answer that question. How did this happen, and how do we make sure this never happen again? That was sort of the impetus of the question. And because I think for a lot of us, Mike, the most disturbing thing, we passed the SAFE Act in Ohio to ban these procedures in our state, and lots of other states have done the same. But then, and federally, President Trump, signed the executive order to stop that. But all the folks who were involved in this still have jobs. The vast majority, they're still there. So how do we explain how this happened, and how do we make sure those folks are held accountable and that this never happens again?
I'm curious, Aaron, because we did so much work here on the SAFE Act, and a lot of those foundations were laid before I was even at CCV.
Yeah.
Were some of the seeds for this report planted as you were hearing from transitioners or detransitioners as part of that process? And is that some of what informed the report?
Yeah, I think for a lot of it, we saw some really obvious things about how this happened, right? And it was so shocking. Like seeing I think the most evident example that the report exposes that a lot of us knew about and have been talked about in other places is the professional associations, right? So, the American American Academy of Pediatrics, and the American, Pediatric Endocrine Society, WPATH, all of these professional associations went all in on gender medicine on kids with no evidence, right? They were just completely bought it. And we saw that in the nationwide fight to end these procedures on kids, because it was always, hey, this is really stupid, they should not be doing this. And the left and the media would come back with, like, no, the professional association, the experts, trust the experts. They all say, we got to do this. This is good medicine. It's not dangerous. You can pause puberty and then turn it right back on, and there's no harms of cross-sex hormones and,
right,
all of that. If you don't do it, the kids are going to kill themselves, right? That was the big one they would say all the time. No evidence behind it, but the professional associations just said, yeah, let's. So we were aware of that when Biden came in, and they really started pushing all of this from the FDA level. We were aware of that. I think that the big thing that surprised us as we began this report, and I think that the linchpin of all of it was the profit motive behind these procedures. And without that, I don't think it would have become so pervasive. Yeah. But with that, it was the lighter fluid that made these things explode.
Yeah, a lot of money to be made as they found out and exploited. And that's probably the most chilling thing that this report reveals. And it exposes $50 million in Medicaid fraud as part of bilking the system in order to line their pockets.
And that's just one one core of it, right? There's another area where we show $10 million of fraud. And again, all of this is just the tip of the iceberg. And we can get into how we went about researching and finding it. But I think one of the things that we talked about early on in the report that again helps understand how this happens. I wanted to find the this is on page 8. That cost data estimates illustrate the scale of the revenues for these hospitals that did this, especially these children's hospitals. According to a comprehensive 2022 analysis of commercially insured transgender patients insured transgender patients using claims data spanning nearly 3 decades, cross-sex hormone therapy entails average yearly payer costs per patient ranging between $545 for androgens, $735 for estrogens, and $16,385 for the more costly puberty blockers. So just understand what that's
16,000
for puberty blockers, right? Like this is for hospitals and for those involved in all of this. This was such a big moneymaker because, Mike, think about what medicine is supposed to be, right? And I even want to talk about this from a Christian perspective, which I say is a true perspective. Our bodies were made with a purpose to function a certain way, right? And what an illness is, when you have a virus, your body is something is happening to your body, and what ends up happening is your body is fighting to bring it back to health, wants to bring it back to sort of the status quo. And that's what good medicine is. There's something, you broke an arm, you want to set it back so your body can operate functionally. And your body participates in that healing process. What transgender medicine is we need to break your body, and then we need to continually break it because your body is going to want to fight back to get back to full health. And transgender medicine is like, no, we just want to continue to break it and keep it broken. And we have to actually fight your body, right? So your body wants to naturally produce estrogen and not have the mass amounts of testosterone. Nope, we want to inject you with high doses of testosterone and have to continue to fight the estrogen that wants to come on. Or your body wants to go through puberty and wants to continue to go through puberty. We need to fight puberty, and it's not a tumor, right? Where you're going to take the tumor out and it's gone. It is nonstop puberty blockers to make you do this. And then it goes on to say this: lifetime totals for a patient starting as a minor can reach $25,000 to $75,000 even without surgeries. For context, we can compare this to the average healthcare spending for children under the age of 18, which is around $3,000. So right there, why did these children's hospitals, when these purple-haired docs walk into their office and say, hey, we want to start a gender clinic? Do I think that the children's hospital CEOs were all ideologues? No, I think they were corrupt capitalists that when they came in and said, we want to do this, we don't want to do this. And then they put the big dollar signs in front of them. And you can see how all of a sudden the vast majority, or at least a lot of children's hospitals, the vast majority in Ohio certainly launch gender clinics.
Yeah. And so the point of the profit motive isn't lost. They're creating what this report calls captive patients. And to your point about needing to continue on the wrong sex hormones and those types of things in order to fight what their body naturally wants to do, you just have that patient that's going to continually go back, cut the check, give you more money, and that's how the money continues to flows in. And you can see from what this report details that once they found that was a revenue stream for them, that they were willing to go all in on it.
And average cost, so if they can get you to progress from the hormones and the puberty blockers to the surgeries, average total cost per person reach $53,645 for vaginoplasty and over $130,000 for phalloplasty. And I'll let, don't Google those things, but you could figure out what those things actually are. And this is, again, if we don't understand this issue through the money-making lens, it doesn't make sense why something so obviously dumb like the concept that a man could get pregnant would be endorsed by basically every major medical institution in the country.
Yeah. And they're targeting children.
Yeah.
Like we can't ignore that part.
It's like the cigarette companies,
yes,
right?
Start them young because then they've got to continue down this.
You got them for life, right?
Yeah, and they just have those, again. The captive patient is the term that they use. As we look at the fraud that's outlined here, Aaron, it can seem a little hard to understand, I think, on one level, but I think on the other, when you just get a basic understanding of how medicine works and how medical billing works, you can kind of see pretty easily how they were able to get around the system. And basically, they just said, we're treating you for this, or we're going to change the code, as they call it, of your condition in order to be able to prescribe this in a way that your insurance or Medicaid will approve, so that we can get money for it. So
that's right. So, for those, anybody who's ever had to fight your insurance company
who has ever had to fight an insurance company,
right? Medical billing is really a two-step process, right? You have the diagnostic code, which is what they say, hey, this is what the injury is, and then you have the treatment code, right? So this is what we're doing to do, and this is the language that the insurance companies use to determine whether they're going to pay for a procedure. We got kids, so you have a strep throat, omeprazole, right? Amoxicillin rather, right? So you go get the diagnosis for strep throat, you need amoxicillin, they pay for it under your insurance. You say she's got strep throat, nope, we're going to put a cast on her right leg. They're going to say, nope, we're not
paying for that.
Yeah, exactly. It's not right. And so that's, and hospitals, one of the major divisions at every hospital, I mean, you came from healthcare, is medical billing, right? It is the lifeblood. If you get this wrong, it actually can be massive False Claim Act fines, right? That can come here. I mean, you just look, you'll find hospitals being billed fined hundreds of millions of dollars for false claims. And so all of this is the language of the hospital. Everybody there knows this. This is a part of the reason why everything is so documented. And, you're sitting down, when you're sitting down in the doctor's office, they're looking at their screen the entire time and typing because they have to make sure they get this right. What our report found was how they were actually going about billing these things to get them paid out. And what we used a 10-year sample from 2015 to 2025 of an all insurance payer database. Now this is going to sound creepy, but it has been the way. This is not a modern sort of AI. Blame the AI. Why this?
Well, given some of the other things we've already talked about, they're plenty creepy. So
yeah, exactly.
This is relatively mild considering.
So basically, every insurance claim that's ever made, or health insurance claim that's ever made, is tracked in a publicly available database. Anybody can actually buy this. This is what these insurance databases are. What insurance companies use to set rates and monitor trends and all the health trends, all of that kind of stuff. It's all de-identified, so you don't know who the person is, but you can actually track a person's medical journey over years across multiple providers, all of those things, right? It's one of the ways we study trends today. This is actually very similar to how the Ethics and Public Policy Center, a similar database that was used on the FDA study regarding mifepristone, right? So we used one of these databases and researched trends around puberty blockers on minors and the various diagnosis codes and all of that. And so, Mike, your point about $50 million in fraud, that's sort of like the big headline that we found on this, which was, a report earlier from last year that came out from HHS under Lior Sapir found there was this massive spike in endocrine disorders diagnoses in minors over the last 10 years.
I wonder if that corresponds with anything.
Why would that happen? Well, what they found was actually a lot of minors were being diagnosed with an endocrine disorder so that they could be prescribed a puberty blocker, right? Because the condition precocious puberty is an endocrine disorder, very rare disorder, but it is, and that's why these puberty blockers exist. Well, two problems with that. It is illegal, actually. It is a False Claims Act violation if there is a more specific code to not use that specific code. for a diagnosis, and try to hide what that is, because that's really, that's the reason why these things are public, because they want to be able to monitor trends and see are things actually going right. If you're purposely not using the correct code or not using the exact code, that's a violation. So we started looking into, okay, how much were these endocrine disorders actually being, this endocrine disorder diagnosis unspecified, being given to kids, followed by a prescription for a puberty blocker with no gender dysphoria diagnosis, which is a diagnosis in the report, and no precocious puberty blocker diagnosis, right? So endocrine disorder diagnosis, puberty blocker treatment on minors. Very clearly a fraud situation. And we found $47 million in that, $8 million, over $8 million in Medicaid. That means taxpayers paid for this.
Yep.
And let's be clear, the kids that they were transing did not have anything wrong with their endocrine systems. Their endocrine systems were completely healthy, right? And this same trend, and again, all the normal caveats, this is potential fraud, right? But we see the spikes here. This same trend was what was used to that the Department of Justice used when they went after the Cleveland Clinic, and the Cleveland Clinic struck that settlement where they ended up having to pay a $300,000 fine and establish a $2 million detransitioner clinic. So already we've seen this methodology be used to successfully prosecute a hospital. And what we see in here is that this is more widespread all across the country and even in Ohio as well. And that's just one of the cases of fraud that the report finds.
Yeah, the other one that I want to mention, just because of the sheer absurdity of it, is when they did prescribe the puberty blocking drugs to kids who were 13 to 17 years old.
Right.
Who are in the range for puberty.
Exactly. And in that case, they gave them the precocious puberty diagnosis, which how can you be 13 years old and be going through puberty too soon?
It's not possible.
It's impossible, right? The average age of puberty for girls is 9 to 10. The average age for boys is 10 and 11, right? By the time you're 16, 17, you certainly can't be going through. And I will say there were other things we saw in here where potential diagnoses for precocious puberty for like 20-year-olds. Yeah, we didn't dive into that here. There's just so much as we were diving into the data that we were like, this is insane. That was coming out.
And digging up receipts that were available, because this wasn't something that was one or two ideologues that were doing this kind of off on their own in their own practice, found, and it's in the report, training that was taking place from these professional organizations telling their people how to bill fraudulently in order to get kids on these drugs.
Mike, that's one of the things that jumped out to all of us, because we had a number of medical professionals involved in the research and writing of this report. And, again, for anybody who works in the healthcare industry, getting diagnosis codes right and taking the False Claims Act seriously is one of the most important things, right? Like it's one of the things you'll often hear doctors just complain about is how cumbersome this is. But it's important. And what we found from WPATH, right, which was just in the news earlier this week, but what we found were slides from WPATH where they were actually training doctors on how to use the endocrine disorder unspecified diagnostic code in order to get these things reimbursed. Now, why? Well, you could think of a couple of reasons why. Again, we don't know. We always have to say allegedly, potentially, all of those types of things here. But think about it this way. Number one, if you are in a red state, let's say, you don't want to see, it probably would look bad for you if all of a sudden there were massive amounts of gender dysphoria diagnoses spiking in your state, right? You would imagine that folks wouldn't want to see that. So you want to, if you make an endocrine disorder unspecified, you're not going to, raise the spotlight on you as much. Or maybe, gender dysphoria And there are still some people that, when all of this was going on, believed the truth. Gender dysphoria, as Admiral Brian Christine, who's the head of the Office of the Assistant Secretary of Health, that's where the report came from. It was his division that published our report. As he said, this makes it potentially more likely that these guys would reimburse this, right? And so, I really think, from that perspective, you can see why these hospitals would go down this path.
Yeah. And you mentioned WPATH, Aaron, a couple of times, and them being in the news recently. A lot of this treatment that has been so just accepted in our culture as this is what you do if someone is dealing with gender dysphoria came from what they said were the really informed standards of care. They were informed by data. This was stuff that had been thoroughly researched and all that. And they're in a deposition or something this week, and
a court filing.
Court filing.
Yeah.
Had to, or I don't know, had to, but they did come out and say, no, that was opinion.
Yep.
Was essentially.
No, it's what, again, it's one of these things, Mike, again, that thank God for Jesus that we know ultimately justice will be done, because these things just drive you mad. There were so many times as we've been fighting against these transgender medicine, this transing of kids, that folks in the media would just call us knuckle draggers, and they'd be like, you got to trust the experts. This is the standards of care. You're not a doctor. How would you know?
Trust the science.
Trust the science, all of this kind of stuff. And they would point to the World Professional Association of Transgender Health. Here's the standards of care says this is what you need to do. And we were like, this is so obviously stupid, right? Like, it's a bad idea to inject children.
As the European countries that have been doing this for 30 years were backing off of all of their standards because they were finding there was no benefit to doing this.
Yes. And so there was no evidence. There was no science to back this up. Everything they had was like opinion polls, or like it was just such bad research studies that they would use of like people who opted in but wouldn't be long-term studies of these individuals. And in a court filing this week, and WPATH admitted that their so-called standards of care were just their opinion, right? And I think for so many folks, like, I pray this should be headline news everywhere, right? Because this is such a betrayal of the trust of the American people. But all of the folks that just went all in on this, need to apologize or be held accountable, because they were so unquestioning of the authorities of the time. So many kids got hurt.
Yeah. And there's going to be a lot of cover for these groups, because when parents are faced with a reckoning of what they've allowed to happen to their kids, they almost have no choice but to just kind of dig their heels in and double down on it, because otherwise they've got to face the reality of what they let happen to their kid.
Yeah.
And so they'll say, well, yeah, the standards were there. Even if they were opinion, it was good opinion.
Yeah. Well, and then you had people like Dr. Eitan Haim, who's one of the authors on the report, who blew the whistle on these on Texas Children's, right? And the FBI came after them. They were trying to be silenced by their clinic. Like, this is it was such a surreal time, right? And it reminds me of COVID in some ways, of just the expectations that we checked our brains out of what was going on and just trust the experts. This is the reason why that can't happen.
While there are financial figures that are in this report, and they are staggering financial figures, it also really details the most significant cost of the kids who had their lives ruined at the expense of these procedures. There's 8 stories, heart-wrenching stories of what families went through, what these children went through, how they were abandoned by this medical community, by medical professionals who said they only wanted the best for them by transing them. And then when they decide, I don't want this anymore, they had no answers for them. They had no care to provide for them, and just left them on their own in very painful circumstances because of the surgeries and mutilation that had happened to their bodies.
Yeah, no, I mean, that's you go through, that was the thing is with this report that we wanted to really land the plane on here, which was, okay, as parents, when my kid is sick, if something's going on with my kid that I don't know, there's three places I think we could typically trust, right? Would be my children's hospital, my medical provider, um, the FDA, right? The federal government's regulating body over these things, and certainly the professional associations, right? These three institutions are ones that when we hear, hey, the FDA, if I hear a drug has been approved by the FDA, I guess prior to 2020, I would have been
prior
like,
to the shot.
yeah, prior to this stuff, I would have been like, okay, I should be able to trust that. That means something to me, right? Or if I heard that, again, the American Academy of Pediatrics said this is the recommended treatment for my kid, I would have said, okay, then we probably should follow that. I'm not a doctor. I don't know these stuff. I should be able to trust them. Or if I go see my provider at a children's hospital and they were recommending it, I'd want to say, let me do that. And we see all three of these areas failed. And we wanted to show the real life cost of this. And so you see these stories of, Clementine Breen, who started down this path at 12 years old, and had a double mastectomy at 14 years old, right? Or Layla Jane, who at 11 started experiencing discomfort with her sex, and at 12 she was put on puberty blockers, and soon after started testosterone. And on her 13th birthday, she underwent a double mastectomy in San Francisco. Her parents were told the failing to allow this sex rejection procedure could mean losing their child. The framing was stark: a live son or a dead daughter. And the crazy thing about that, Mike, is Layla Jane went through this in San Francisco. We heard these same things here in Columbus and in Cincinnati, right? There was a script for this stuff. And all of these kids were harmed because, and these are just 8 examples. And some of these are parent stories too, where you hear the parents talking about the pressure they were under, right, to go through with these things. And we saw just here in Ohio as well, one family where they lost their daughter because they wouldn't agree to put her on high dose testosterone. This is the kind of stuff like that says to me, we need real consequences for what was done. It's not enough to just ban these things. The people that did this need to be punished so that they know to never do it again, and the next generation never does this again.
What are some of those potential consequences? I know we can't really speculate, but we do know Vice President J.D. Vance came out today with a video after this report was released and saying that people who were named in this report have been referred to the Department of Justice and to the HHS Inspector General. Yeah. So what does that mean, and where could that lead?
Yeah, so I would start with looking at what happened with the Cleveland Clinic and Texas Children's. Right. So I think the examples there are really great examples of the types of primarily civil penalties that can be levied against these folks. I do know, like our report ends, for example, with, hey, there's potential criminal activity that's gone on here, where as we were researching what was going on, the puberty blocker fraud is it's all really hard to understand. You need a lot of great minds to work through this stuff. The puberty blocker fraud is easier to identify. The cross-sex hormone fraud is a little bit more difficult. But one of the things we found when we were working on this report was minors given a gender dysphoria diagnosis, and then on the same day being prescribed a hormone. And those were done in a state where these procedures were banned. So we include that in the report as and it's one of the reasons we're calling in Ohio alone, hey, Attorney General Andy Wilson, you need to investigate these claims and see what was going on here. And so that could be criminal penalties in some states where that happened. The other thing, though, that we're going to be calling for is hearings in Congress, right? These children's hospital CEOs that oversaw this, they need to be held to account. right? Because that's the thing that when these children's hospitals understand that defrauding the government, defrauding insurance, and harming kids is never worth the money you're making. They apparently didn't know that, so they need to be taught that lesson.
And I need to plug here too. It's a little bit of a tangent, but not much. This really shows that the ideology is still out there, especially with an election coming up.
Oh my gosh, 100%.
Because we've seen it with the stuff that's going on with the WNBA right now, with what this report reveals about gender ideology. There's so much of this that we can't, as Christians, just sit back and say, well, I thought Trump took care of that with the executive order. You need to get out and vote because these issues are still very much in play this November.
Right. So you already saw Vivek Ramaswamy called this out. Where's Amy Acton on this, right? David Pepper, her running mate, criticized the Save Ohio the Save Women's Sports bill in Ohio, right? We have huge Senate elections all over the country right now, not just here in Ohio, but you're seeing we're in Minnesota as everywhere. What's going? All of these folks need to answer because they have clinics in their state that participated in this, and are they going to allow this to just kick back up in the years to come? It's one of those questions that is should be easy for everyone to answer. Don't trans kids, and two is one of those things that is a real litmus test of the courage that you're going to have as a leader.
For people listening who want more information on this, we've got a website. It's hhsinsuranceFraud.org. You can download a copy of the report. You can read some of the stories. There's a very powerful documentary that HHS put together with a number of these.
You've got to see it. It's 13 minutes long. It's well worth it.
Yeah. Parental advisory on that one, and they do put that up before the video starts, but very powerful stories about why this is so necessary. You can also fill out our action alert to contact the Ohio Attorney General there as well. And hopefully that's a great resource that you can share with people to let them know why this is such a big deal, why it needs to be taken seriously, and what they can do about it. Because Christians, we need you on this one to be the change that we want to see.
Yeah, no, that's right. And Mike, I'd be remiss if I didn't just say, number one, God bless and thank you, President Trump, for building out a administration that would publish a report like this, right? And would not be afraid of the medical institutions that were harming it. Because, right, the easy answer here is like, all right, they stopped. Everyone kind of likes the children's hospitals. We don't want to kick the hornets.
Shouldn't we leave them alone now?
Right. Yeah. And it's like, no, there needs to be accountability. So credit to President Trump for doing this, and certainly to Vice President Vance and his anti-fraud task force for bringing it forward. Obviously, Robert F. Kennedy has been phenomenal on this issue. What shouldn't be lost on this is that this report was released from, it's called OASH, the Office of the Assistant Secretary of Health. That's led by an incredible man of God, Admiral Brian Christine. Was previous led by another man named Richard Levine, who went by the name Rachel Levine.
Babylon Bee's Man of the Year.
Babylon Bee's Man of the Year, right? And it is just so poetic that, under Richard Levine, that's where so much of the harm was done, right? It's documented in this report of how much his office was driving these things on kids. And so for that same office now to be publishing this report, exposing it, is just impactful. So I'm so grateful for all of them. Natalie Dodson over in HHS as well was incredibly involved in this and phenomenal. And then just the co-authors, Dr. Aaron Cariotti, Dr. Eitan Heim, Rachel Morrison from the Ethics and Public Policy Center, Dr. Quentin Van Meter, Victoria Coley, and all of her team over at the Independent Women's Forum. Obviously, David Mahan and Ryan Foltz here at CCV, Mike, you and your team with all of the amazing resources, May Mailman, who was involved in this as well. It just was, there are so many talented and committed people. That's how we've been able to get on this course, is that people have shown more courage today than ever before. And hopefully this report will truly be the moment of accountability that so many people have been afraid of and so many people have been calling for.
Yeah. Well, grateful for your leadership on this, Aaron, for your contributions to this report. HHS Insurance Fraud is where you can learn more about it. HHSinsurancefraud.org is where you can learn more about it. And we thank you for listening into this conversation today, and stay tuned. I'm sure there's plenty more to come as we see where this goes from here. So thanks for tuning in today on The Narrative.